So we're going to talk about eye problems in the bush, and these are common problems that you may well come across, not just in the bush, but also in everyday practice. So with any good approach, you want to get a history, and this is one of my favourite Christmas cards, the three wise men, and they've been tramping through the desert, and the wise man says, "Hold still, now look up, you've got something in your eye, right? Could be sand." And obviously it's around Christmas time. That they've been tramping through the desert on their camels, and the one wise man's got something in his eye, and hopefully the other wise man has washed his hand before touching the other guy's eye. And the chances are it could be sand, could be camel hair, we don't know, but yeah, I think it's a good bet that it could well be sand. So you want to know when it's happened, what they were doing, and potential environmental factors. One of the most important things to document in your eye history is the visual acuity, and this actually is a medico-legal requirement. So the first thing you do when you get an eye condition, measure the visual acuity. We tend to use this thing called a Snellen chart, and the Snellen chart traditionally is measured from 6 meters. So 6 meters is what they call eye infinity. So anything less than 6 meters, the eye tends to accommodate, whereas 6 meters, the eye is totally relaxed. So with the nomenclature, the 6 goes on top, so that's 6 meters, and all the different lines in the Snellen chart represent different levels of vision. So say on the top letter it's usually 660, and then it goes 636, 624, 618, 612, 69, 66, and sometimes there's a 65 line, and there may be a 64 line on some charts. So the idea of the 6 nomenclature is that it was measured from 6 meters, and say the 612 means that the normal person can see it from 12 meters, and the patient can only see it from 6 meters. So for instance, say 660, the patient can see it at 6 meters, whereas a normal person could actually see it from 60 meters. So it gives you an idea of the relative scale compared to normal. You can move the Snellen chart a bit closer. You don't always have the luxury of a 6 meter room, and a lot of the eye clinics have 3 meter rooms, and they have a mirror. So often the Snellen chart is back to front because people are reading off the mirror. If you don't have that luxury, you can do it at 4 meters, and so instead of putting a 6 there, you put a 4 there. Sometimes you even move the chart up close to the patient, say from 1 meter, especially if their vision's not very good, and then you put the 1 on top. If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.